Hi, my name is Dr. Emmanuel Aguh. I'm a family medicine hospitalist here at Sovah Health Danville, where I've been working over the past 2 years. A little bit about myself. I am an international medical graduate from Nigeria, where I went to medical school, after which I transitioned over to Texas Tech University Health Sciences Center in El Paso for a family medicine residency that I completed about 2 years ago, after which I came to Danville, where I've been working, and it has been a great time as I have been able to have great experiences with patients of all ages and their families that have made my stay here in Danville an awesome one. And I also love providing healthcare services to people in communities like this. I love being a doctor, and it's been great offering healthcare services to people in underserved areas and in areas where healthcare services are really required and needed. Right now, I'm going to give you an update regarding the current COVID situation here at Sovah Health. Our latest numbers show that currently we have approximately 25 patients across both campuses that are currently being treated for COVID-19, with a slight reduction from last week where we had about 30 patients approximately across both campuses. We have about 15 patients here on the Danville campus and about less than 10 patients over in Martinsville at this moment. Just want to assure you and your families that we have the capacity to meet your needs regarding caring for patients with COVID-19, including intensive care needs, okay? So another thing I was going to talk about is the visitation policy. Our visitation policy still stands as a limited visitation policy. Also, we note that last week you were given an update regarding some changes where you were allowed one well visitor per patient coming to the ER. That policy still stands, so we still allow one well visitor per patient in the emergency room. There are some exceptions to the hospital policies, and to review these exceptions, you need to go to the website sovahhealth.com, and you can get directed to the COVID preparedness page. There's a link at the top of the page where you can have access to this page that will give you more information about our guidance policies. I know last week we were spoken to about flu and giving some guidance regarding the flu season and things to do. This week we're going to talk about mask guidance. Just want to let you know that COVID-19 can be spread by individuals that are asymptomatic, people that don't know that they have the symptoms. So that's why it's recommended that everyone wears masks. But one thing you need to know is that not all masks are created equal, okay? Regarding masks, we have the ones that are more recommended and the ones that are not really recommended. The ones that are recommended are like the surgical masks that you see around, that you see physicians wear, and sometimes actually available in stores. These ones, and also cloth coverings, help protecting you from large particle respiratory droplets that can actually spread from asymptomatic individuals, and also protect yourself from other people around you that may be positive but also asymptomatic. So it's recommended that these are the kind of masks that you wear. Regarding the masks that we do not really recommend, the first one on the list is the masks that have the respiratory valves on the side, either on one side or on both sides. These masks might protect you as an individual but do not protect other people, because it allows unfiltered air to escape, and this carry droplets that can infect other people. So we do not recommend people to wear masks that have valves on both sides or on either side, because they kind of like pretty much affect the integrity of the mask itself. The second one that we do not recommend are masks that have zippers. So these masks also, like I said, having the zipper there affects the integrity of the mask, but also there's some times that you might forget to close the zip and leave it open, thereby exposing yourself and other people to the risk of infection. And also finally, when you touch the mask all the time, trying to open it up so you can eat or drink and close it back up, you increase the risk of contamination, because you can have droplets on the mask that can come in contact with your hands, and that could increase your risk of an infection also. The third masks that we have concerns about are the lace masks, the crocheted masks. I know people like to be fashionable sometimes and wear nice masks that look that match your outfit, but These masks also do not give you the kind of protection that cloth masks and surgical masks give you, because they have larger holes that allow these particles to actually penetrate and actually get into your system. And also, if you sneeze or cough while wearing these masks, you can also infect other people around you. So we do not recommend you using any of these 3 masks. The ones with the valves, the ones with the zippers, and also the ones that are knitted, crocheted, or lace masks. These do not protect yourself or other people around you well enough. We recommend the surgical masks and cloth face coverings. Regarding the issues of masks, I just want to let you know that the CDC does not recommend face shields as a substitute for face masks. Okay, the face shields have, in some instances, people tend to use the face shields believing that they get the same protection as the face mask because they're less they don't obstruct their mouth and their nose, and they feel like they can breathe better. But the thing is, these face shields can cover your eyes and protect, I guess, your eyes, and sometimes are recommended to be used in conjunction with the face masks. But by themselves, we do not know, or studies have not shown how effective they are in protecting yourself or other people from respiratory droplets, if, for instance, you sneeze or cough. So we do not recommend you switching your face mask for a face shield. You can rather use both of them together or stick with your face masks. And finally, I'd like to reassure you that it's safe for you and your family members to come to the hospital if you have any need for that. Also want to let you know that our staff members are here and are able to serve your needs whenever that's required. Do not hesitate to visit your primary care physicians and your specialists for your scheduled appointments, as this will be very beneficial to you. Do not delay your health care, and sure to come to the hospital if there's a need or if a need arises. Thank you. Have a great day.